Blood vessels. Arterial branches of systemic circulation. All are branches from aorta supplying arms, head, lower limbs and all viscera with O2 from the lungs. Aorta arises from left ventricle, thickest chamber. 4 major divisions of aorta. Ascending aorta. Arch of aorta. Thoracic aorta. Abdominal aorta. Aorta ascending aorta leaves left ventricle arch of aorta. Brachiocephalic trunk. Right common carotid. Right subclavian. Left common carotid. Left subclavian. Thoracic aorta from arch to diaphragm. Abdominal aorta. At level of L4 vertebra divides into left and right common iliac arteries which carry blood to lower limbs, aorta and its superior branches. Aorta is largest artery of the body. Ascending aorta. 2 coronary arteries supply myocardium. Arch of aorta, branches to the arms and head. Brachiocephalic trunk branches into right common carotid and right subclavian. Left subclavian and left carotid arise independently. Thoracic aorta supplies branches to pericardium, esophagus, bronchi, diaphragm, intercostal and chest muscles, mammary gland, skin, vertebrae and spinal cord. Coronary circulation. Right and left coronary arteries branch to supply heart muscle. Anterior and posterior interventricular AA. Subclavian branches. Subclavian AA. Pass superior to the first rib. Gives rise to vertebral A. That supplies blood to the circle of Willis on the base of the brain. Become the axillary artery in the armpit. Become the brachial in the arm. Divide into radial and ulnar branches in the forearm. Common carotid branches. Circle of Willis. External carotid arteries. Supplies structures external to skull as branches of maxillary and superficial temporal branches. Internal carotid arteries contribute to circle of Willis. Supply eyeballs and parts of brain. Abdominal aorta and its branches. Supplies abdominal and pelvic viscera and lower extremities. Celiac AA. Supplies liver, stomach, spleen and pancreas. Superior and inferior mesenteric AA. Supply intestines. Renal AA supply kidneys. Gonadal AA. Supply ovaries and testes. Splits into common iliac AA at 4th lumbar vertebrae. External iliac AA supply lower extremity. Internal iliac AA supply pelvic viscera. Visceral branches off abdominal aorta. Celiac artery is first branch inferior to diaphragm. Left gastric artery, splenic artery, common hepatic artery. Superior mesenteric artery lies in mesentery. Pancreatic duodenal, jejunal, ileocolic, ascending and middle colic AA. Inferior mesenteric artery. Descending colon, sigmoid colon and rectal AA. Common iliac arteries branch into external iliac arteries that go on to supply the lower limbs and internal iliac arteries that supply uterus, prostrate, buttock muscles and bladder. External iliac becomes femoral artery after inguinal ligament, then popliteal at the knee and then divides into anterior and posterior tibial arteries in the leg. Arteries of the lower extremity. External iliac artery become femoral artery when it passes under the inguinal ligament and into the thigh. Femoral artery becomes popliteal artery behind the knee. Veins of the systemic circulation. Drain blood from entire body and return it to right side of heart. Deep veins parallel the arteries in the region. Superficial veins are found just beneath the skin. All venous blood drains to either superior or inferior vena cava or coronary sinus. Major systemic veins all empty into the right atrium of the heart. Superior vena cava drains the head and upper extremities. Inferior vena cava drains the abdomen, pelvis and lower limbs. Coronary sinus is large vein draining the heart muscle back into the heart. Veins of the head and neck. External and internal jugular veins drain the head and neck into the superior vena cava. Durovenous sinus is empty into internal jugular vein. Venipuncture is normally performed at cubital fossa, dorsum of the hand or great saphenous vein in infants. Hepatic portal circulation. A portal system carries blood between two capillary networks, in this case from capillaries of the gastrointestinal tract to sinusoids of the liver. The hepatic portal circulation collects blood from the veins of the pancreas, spleen, stomach, intestines, and gallbladder and directs it into the hepatic portal vein of the liver before it returns to the heart. Enables nutrient utilization and blood detoxification by the liver. Hepatic portal system subdivision of systemic circulation. Detours venous blood from GI tract to liver on its way to the heart. Liver stores or modifies nutrients. Formed by union of splenic, superior mesenteric and hepatic veins.